Karan Shetty, consultant orthopedic and joint replacement surgeon at Fortis Hospital, Nagarbhavi. I'm here to talk about total knee replacement surgery. Total knee replacement surgery is a life-changing surgery for those who are suffering from chronic long-standing knee pain. This could be from various reasons. It could be age-related osteoarthritis, or it could be following inflammatory problems like rheumatoid arthritis, or it could be post-traumatic after a fracture in the distal far end of thigh or in the upper end of the shin bone. And this is usually who benefits from a total knee replacement. If you are having the above problems which I mentioned earlier, and you have exhausted all medical and non-surgical options for pain relief, and it is affecting your daily activities, then total knee replacement is most likely going to help you. So how does the total knee replacement help? It helps in pain relief, it restores the normal alignment of the knee, it improves mobility and function. So it is a potentially life-changing surgery. So if you are suffering from chronic knee pain, your activities of daily living, your lifestyle would be severely affected, and knee replacement will get you back into mobility again. So what to expect after a total knee replacement surgery? Within a few weeks after surgery, you will be able to walk independently with minimal support, and almost after 3 months after surgery, you will be able to do everything which you always wanted to do. You can climb stairs, travel around the world, and do every activity which is possible. The take-home message, total knee replacement is a life-changing procedure. If the knee pain is taking control of you, it's time to take the control back. If you feel knee replacement is for you, do visit us at Fortis Hospital and consult us, and we will see if knee replacement surgery is going to help you. Thank you.